We'll move on to question 3. Our third theme is healthcare. Mr. Obhrai will be the first to respond. Healthcare spending in Nova Scotia represents approximately 40% of government spending. Awareness of mental illness has been growing in Nova Scotia, along with a significant increase in people attempting to access mental health care. Government spending regularly exceeds planned spending. What is your plan to address mental health in federal health care transfers, and would this be a priority?
Thank you, Rob. Healthcare in Canada is a shared responsibility with the provinces according to the Constitution and is a pillar of Canadian identity. I will always respect healthcare initiatives that are beneficial to elderly care, improving mental health, alternative medicine, home care delivery, or compassion for terminal ill, as well as advocating the best practices in the healthcare system. However, I feel we need to create a national agency to standardize qualifications, certifications, and code of conduct for evidence-based medical professions. This will help reduce unnecessary costs and fast-track qualified professionals to fill the gaps across the country. We must also address accessibility to affordable drugs, and I think because of our aging population, we must take a very bold step. Let's have a dialogue on pharmacare. Thank you.
Pierre Lemieux.
Thank you. I think once again you're going to hear a lot of similarity in response. So for me, one of the greatest threats to our healthcare system is the legalization of euthanasia and assisted suicide. And I think sometimes we get very comfortable with those words of euthanasia and assisted suicide, and we can overlook what's really going on. For the first time ever, the patient can say to the medical system or to their doctor, "Kill me." And this is a seismic shift in our healthcare system. People do not want to die in pain, and they certainly don't want their loved ones to die in pain, which is why, as Prime Minister, I would prioritize palliative care, which absolutely excels at the managing and alleviating of end-of-life pain so that people are comfortable, so that people do not need to choose euthanasia or assisted suicide. The other thing to realize, too, is that euthanasia and assisted suicide is going to cost a lot less than palliative care. So unless you have a leader that actually prioritizes palliative care and says, I will put tremendous funding into palliative care and pain management research, then euthanasia will become the least expensive option. Thank you.
Rick Peterson.
This is my favorite topic. Among everybody here up at the stage, I'm the only one that works day-to-day inside with entrepreneurs in Canada. And what our healthcare needs is more private sector approach, private sector ideas, private sector presence. I'm going to give you a heads up on Tuesday of next week, February 12th. You're going to see a detailed proposal that's going to give the provinces more say under my leadership as Prime Minister. You're going to find that Dr. Brian Day, who is leading a Supreme Court challenge in British Columbia, is going to come out and support my plan, my approach. Ladies and gentlemen, let's be clear here. All of us, I'm 62, I think there's a few of you a little older, a little younger than me, tremendous pressure on the healthcare system. You will pay. You will pay. Your health will pay. Your family will pay unless we have innovation, unless we have more choice, unless we have health insurance that is more attuned to the needs of everybody out there. We're going to get hurt. Under my leadership, that will stop. We're going to turn the corner and we'll get real solutions.
Andrew Scheer.
Well, with respect to mental health, absolutely, the federal government can play a leadership role with the provinces in first tearing down the stigma around mental health. And I'd like to salute all of those on stage here and all of you in the room who took part in the Bell Let's Talk Day. That was a huge initiative, I think. An important step to get people talking about those issues. But more than just talk, we do need action. And I endorse the Kirby Commission report. I'm very proud to have the support of my colleague, Senator Denise Batters, who has really championed mental health issues. I want to build on what the previous Conservative government did to help our veterans with mental health issues who have come back from putting their lives on the line around the world. The federal government has a responsibility to those veterans, and as Prime Minister, I will make that a priority.
Maxime Bernier.
Canada has the worst wait times for surgery in the developed countries. We are the country who spend the most for health care in the OECD countries. So we must do something, but also health care, it's a 100% provincial jurisdiction. So what we can do in line with respecting our Constitution, instead of taxing Canadian and giving that to provinces, what we must do, we must lower taxes at the federal level and transfer tax points to provinces. Like that, they will be responsible, accountable before their population, and they will have the right incentive for having a universal mixed system, mixed healthcare system with private delivery and public delivery of services, but not like the US, like in Europe, like in Japan, like in Australia. So we can fix it, we can give the right incentive to provinces to do it. That is the solution and the right solution.
Stephen Blaney.
Yeah, thank you. So, Rob, when I was public safety minister, police officers would tell me that most of the time they would encounter mental illness cases. So that's why we develop HUB, multidisciplinary team. So we don't necessarily need to have more money in that area, but rearrange the way we are dealing with mental issues. We find it also in our prison as well. Now that's an issue. Under the Harper government, we transfer massive amount to provinces in a partnership way. Now we have Justin Trudeau. Justin Trudeau is my way or the highway. It's Ottawa's knows best. I agree with Maxime that we need to respect provinces who have their jurisdiction and also to empower them to explore innovative and more efficient way to provide health care. Thank you.
Kevin O'Leary.
Actually, the problem with healthcare as it's constructed now in Canada has a lot to do with the economy. You saw recently the squabbles on transfer taxes because what's really occurring is Canada does not work at 0.7% GDP growth. The system does work at 3%. We have to find a way to get everything working, not just for healthcare, for education, for military, and for our social net. The bottom line, the reason we have these long wait times for cataract and hip replacement surgeries, etc., is because the cupboard is bare. You can't make it work. Whether you transfer or whatever structure you want will not work unless we get growth back to 3%. That is the core problem. Now, we have a Health Act here that puts it back to the provinces, but the transfer payments are really what the debate is about. You saw how contentious that was just a few weeks ago. That's because the economy is not growing. This problem will not go away. It's only going to get worse, and wait times will even extend. Have to get to 3%. That's the primary mandate of anybody up here on this podium.
Kellie Leitch.
Well, as a practicing physician and surgeon, I have a bit of a different perspective than I think others sitting at this table. And I've been in operating rooms, and I've focused on health innovation. And there are real problems. And anyone out there that says to you that there are simple solutions to this, that it's just about when you show up with your Visa card at the emergency department, they're just simply not telling you the truth. My focus will be different. My focus is not on the bickering between the provinces and the federal government, but quite frankly on a focus on the patient, making sure that your loved one gets access to the mental health services they need. Because the system should be serving you, making sure that you and your family members get what you deserve. You deserve timely access to care, high-quality care, and we're not just going to achieve that by showing up with a bigger bank card.
Michael Chong.
Thanks, Rob. I think the question was about whether federal government should compel provinces to deliver mental health care services in a certain way. And my view is that the federal government should not put conditions on federal transfers to the provinces for allocations to specific forms of health care delivery. You know, we have a future premier in here, Jamie Bailey, and we certainly don't want to tie his hands as the premier of this province in delivering public health care services for Nova Scotians. So I think the federal role is to ensure long-term sustainable transfers for health care for each province. The previous government took that approach. Over the 10-year period from 2006 to 2016, federal health care transfers grew at an annualized compounded rate of about 5.7% per annum. That's a healthy rate of increase, a predictable rate of increase that allowed provinces to plan out for the delivery of their healthcare systems.
Andrew Saxton.
A few years ago, I rushed my mother to the emergency of our local hospital, and we were told to wait. And over the next 3 hours, we waited, and I watched my mother have a stroke in the waiting room of that hospital. I don't want anybody in this room to go through that experience that I went through. I don't believe that throwing money at the problem is necessarily the solution. We spend more on health care than just about any other country, but we're number 17 when it comes to receiving services. We have to find a more efficient and effective way of delivering health care to Canadians. And that might mean that we might have to look at the private delivery of health care in Canada, because I think Canada is one of the 3 last countries, along with Cuba and North Korea, that only has one delivery system of health care. We need a more efficient system, and as Prime Minister, I'll make sure that we have a health care system that works for all Canadians.
Brad Trost.
The question was about mental health and prioritize it. And I think each and every one of us here wants to prioritize it. A lot of us up here were good personal friends with a member of Parliament who had some real struggles with it that did not end well. So we want to prioritize it. But how do we decide it's a more greater priority than things like old age homes, waiting lists? I have to admit, I don't think the federal government in Ottawa should tell the provinces exactly how to do it, because different provinces have different problems. I really hope mental health care is one of the top, because I have a personal interest in it. But what this comes down to is we need to change the system. We need to give the provinces flexibility. We need to make sure all Canadians are covered and they can have health care from coast to coast. We give them that flexibility there, and we need to give the provinces the ability to solve these problems with adequate funding.
Erin O'Toole.
Thank you. One of the proudest days I had as Minister of Veterans Affairs was in Halifax when I announced the new Operational Stress Injury Clinic here in Halifax. Why that was special? The men and women of the Navy and the Air Force will be served by this, and I served with the Navy and the Sea King Squadron here in Nova Scotia, where I met my wife, Rebecca. So being here was very special to make sure we're taking care of those needs. We also announced support for service dogs, and some of the advocates, Medrick Cousineau here in Eastern Passage, has been a leader nationally on that. And I know Jamie Bailey, Carla McFarlane, and others are working on veteran mental health in particular. My worry is the 2-tier healthcare system that's emerging in Canada. Atlantic Canada versus the rest of Canada, especially urban Canada. With the shrinking population and demographic challenges, the federal government has to find a way to help particularly rural parts of Nova Scotia. My plan, I announced doubling the expense credit, tax credit for people in rural areas, incentivizing healthcare professionals to come here.
Chris Alexander.
We tend to give answers with regard to the mental health challenge, the mental health crisis, that involve bringing government together or asking the provinces to do more or thinking about other priorities. We need to accept that this is an overriding new priority, that this is an area that needs to be addressed urgently because there are too many people suffering from mental health problems in our correction system who wouldn't have offended if they had been treated properly. There are too many people who are homeless, not because they can't find a place to live, but because of mental health issues. It's a continuing issue in the Canadian Forces, and it needs to be addressed as a priority. I would make this a priority as Prime Minister, to measure results, to expect results, to make sure that Canada multiplies the number of healthcare professionals on the front lines tomorrow.
Lisa Raitt.
Thank you very much, Rob. When I was Minister of Labour, myself, Leona Glucock, and Diane Finley banded together to ensure that we gave a little bit of money, $32,000, to make sure that we'd have a standard for workplace safety, for workplace mental health. And it has grown into Bell Canada Let's Talk. It has grown into a first aid kit. The work that we did at the Mental Health Commission of Canada is amazing. We can get caught up talking about how much money is going to go to what province and what strings are going to be attached, but I can tell you this. I know for a fact that a Prime Minister who tells their ministers of justice, of health, of labour, of human resources, of defence, of veterans affairs, of transportation, that we are going to actually value mental health in the workplace, and we're going to work together to ensure that there's no stigma and that we do better as a society, you will see huge gains in dealing with this issue. And it's not just about transfer funds.
Thank you. Now on to rebuttals. First, Rick Peterson.
Thanks, Rob.
Kevin O'Leary says that it's the economy, but he doesn't have a plan. He's got a guitar, but I haven't seen a plan yet. And go to petersonleader.ca, and you'll see a clear plan to cut corporate income tax to 0, your personal federal tax to 15, and grow the economy and grow the whole economy so that healthcare counts. Michael Chong wants to increase some spending. Chris Alexander is going to increase some spending. How are you going to do it? You got to grow the economy. It's the economy, ladies and gentlemen, that is going to be a driver of your healthcare solutions. I have a plan. petersonleader.ca. Let's get real about how we're going to get out of this. Thank you.
Brad Trost.
As Conservatives, we all agree that the provinces have the primary role in healthcare, and we don't want to tie the hands of the new Premier here, soon-to-be new Premier. But there are practical things the federal government can do. Changing and helping immigration laws so we can get doctors into rural areas. Nova Scotia is probably like a lot of the rest of the country. There's probably a shortage of doctors in some parts of the country. We can help the provinces by adjusting immigration rules and laws to encourage foreign doctors to settle in areas that need them.
Erin O'Toole.
Thank you. Just days before coming to the large gathering here of Tories in Nova Scotia, Maxime Bernier announced his plan on equalization. He wants to phase out equalization. What he also said tonight about tax points and the transfer for maritime provinces with economies at challenge and demographic challenges, ending equalization, transfer tax points will hollow out services for Atlantic Canadians. As Prime Minister, I will not allow that to happen. Thank you.
Pierre Lemieux.
Can you hear me? Yes, thank you very much. I mentioned euthanasia earlier this evening, and on behalf of medical health practitioners, I want you to know that as a leader and future Prime Minister, I'm a very strong advocate for conscience legislation to protect our medical practitioners who have deeply held convictions regarding euthanasia and assisted suicide. They should not be forced to participate in this process if it is against their deeply held convictions, and the only way to protect them is with conscience legislation. Thank you.
Andrew Saxton.
Yes, I also heard that Maxime wants to reduce equalization. Well, I can tell you that equalization is not the problem in the eastern provinces. The problem are Liberal governments that have caused these problems in the Maritimes. We need to get good Conservative governments elected here, and Mr. Bailey needs to get elected, so please help him in the next election. I can tell you the economy will be the #1 issue in the next election. I'm the only candidate who has significant financial experience in both the private sector over 30 years, as well as in government. I was Jim Flair.
Maxime Bernier.
Yes, I want to review the equalization formula because it's not good for you. It's not good for Quebecers also. I don't want to punish you if you want to develop your natural resources. I don't want to punish you if you want to lower your taxes at the provincial level. We need to have an equalization formula that would be fair for every Canadian, and that will give an incentive to the province, to every province across the country, to develop their natural resources. And so that's why, yes, I want to do that, because I know it will be good for every region of this country.
Erin O'Toole.
So, Maxime, when the tax base here is shrinking, so there's less tax points to transfer, and you're going to end equalization, aren't you basically saying to Atlantic Canada that you're going to have two-tier health care because the federal government will no longer make sure there's equal access? That's what equalization is, friends. We make sure that the Canadian family all benefit from our programs. Sometimes these simple responses to issues need to be explained, Maxime. I think you owe it to this crowd to explain it.
Michael Chong.
Thank you, Rob. Maxime, I like a lot of the ideas that you're proposing in this race, but there's one idea that I think will be an electoral devastation for us, and that's your proposal to scrap the Canada Health Act and to remove the federal government entirely from the delivery of public health care in this country. The vast majority of Canadians believe in our public Medicare system, and they don't want to see the federal government's role scrapped. They don't want to see the Canada Health Act scrapped, and I think that would be a big problem for us in the next election.
Deepak Obhrai.
Thank you, Maxine. Equalization issue. In this country of ours, we have provinces which are growing at a different rate. And some provinces have resources, their income is higher than the other provinces. And so you could have a living of standard which is very different. Equalization provides that all Canadians have a standard which is equal across the country. That is the strength of equalization. That is why we need equalization. Thank you.
Thank you.